So we will now proceed to our second plenary session. This session will be chaired by Dr. Dinesh Sir. Sir is a Senior Technical Advisor, JPICO. Dr. Dinesh Sir is a Senior Technical Advisor, JPICO, affiliate of Johns Hopkins University, USA. Sir is very closely working with nursing education since 2009, and Sir is determined to improve quality of nursing education and dignifying the nursing profession. I would like Sir to kindly grace this stage. And to formally welcome Dr. Dinesh Sir, I would like Mrs. Anamika Chaurasia Ma'am to kindly welcome Sir with a live plant. And before we proceed, I would like to inform that the chairperson for this session has to be Dr. Santosh S.U. Sir, but due to emergency inspection, he couldn't join us. So we are so blessed that Dr. Dinesh Sir joined us and he was ready to be our chairperson for this session. Thank you so much, sir. So accompanying Sir, I would like our esteemed speaker, Mr. Hari Shankar Sir, to join us on the stage. And once again, I would like Dr. Deepti Shukla ma'am to kindly formally welcome Sir. Sir will be delving deep into the topic simulation-based learning in nursing. Now I request Dr. Dinesh Sir to formally introduce our speaker, Mr. Harikant Sir.
So it's, ladies and gentlemen, it's always a pleasure to introduce Hari, because Hari has been a great friend, a colleague. I did not know, tell you frankly, that I will have to do the honors of introducing him. But I feel privileged to welcome Hari, who is a distinguished professional in this field for last 28 years. IT is his forte, and he has done tremendous work in this area. He is head of the IT and administration at Era University. He also heads the operations of the Criterion Lab, the small clip you saw just a little while ago. He's a member of the Health Record Association of India, and his commitment to innovations is tremendous. Believe me, every time I go and meet him, I have a new product coming up, you know. And he's so open to suggestions and all. So hats off, Hari. And he continues to bridge the gap between IT and healthcare, and I hope all of us will gain from the transformation era and his team is doing. Thank you, Hari.
We are living in an era where technology, artificial intelligence, machine learning, and advanced tools like ChatGPT, DeepSeek, Grok, Nomad, Gemini, Perplexity are shaping the future. In this age of rapid technological advancement, it is important that teaching, training, and healthcare treatment evolve alongside these innovations. Today, technology in healthcare is growing faster than ever before. The use of simulation in nursing education, training, and patient care is at the forefront of this transformation. By integrating cutting-edge technology into these areas, we can enrich knowledge, enhance skills, and, most importantly, reduce medical errors, ultimately improving the quality and safety of healthcare for everyone. In a 2016 study published in British Medical Journal, it was stated that medical errors are the third largest killer in USA. According to WHO, 1 in 10 hospital admissions leads to an adverse event, and 1 in every 300 admissions leads to death. Harvard University has estimated that such incidents result in the loss of 3 million years of healthy life in India every year.
So as the theme of this conference is advancing nursing, so innovations, research and digital health. So we all agree that we are in era of technology, and you saw in this video, medical error is the third largest killer in US. We are talking about the US where every patient is documented, even every citizen is documented. So after heart and cancer, medical error is the third largest killer, we say. So what we can say about the India? So the digitalization in the healthcare will help us a lot. So today the topic of this presentation is simulation-based learning in nursing, enhancing patient safety and clinical trial. Myself, Hari Shankar, I'm head IT and administration in Era Medical College and Era University. And I'm also operation head of the company which is manufacturing these softwares and hardware in mannequins as the operation head. For last 2 decades, I'm working for the ERA. So thank you, Dr. Dinesh, for introducing me, and thank you, Dr. Deepti, organizing chairperson, and to speak among this august audience. Why I say august audience? Because I always say, like madam is sitting here, our vice principal, nurses are the heart of the hospital. Why? Because their care towards the patient, their hard work, their dedication always give us motivation. Even it is incredible. I say it is incredible. So I think on the first day before yesterday, when TNI President Evelyn Madam said that with the patient, 85% our nurses are there. Only 15% our doctors. If you don't mind because you are a doctor sitting in front of me. So 85% engagement with the patient is our nurses. So I highly salute all of you, and I salute all the faculties who are making it possible. So I have divided this my presentation in 3 key aspects. First, what the elite personalities and scholars say about the 3D medical simulations. Additionally, what are the latest guidelines by NAP 2020, INC, Indian Nursing Council, and National Medical Commission. Secondly, I will display the medical simulations, its definition, types of simulation with the relevant video presentations. Second, the real-time remote monitoring dashboard, a software with artificial intelligence, machine learning, and smart alerts for the patient.
Harry introduced me as well.
Oh, I'm sorry. I forgot to introduce my AI friend Simu. To present this session with me, I have my AI friend Simu. She will be assisting me throughout this presentation. So I seek permission from Dr. Dinesh. May I proceed with Simu? Yeah, thank you.
Thank you, Hari. And thank you everyone for accepting me to be a part of this presentation.
Okay, Simu. Do you remember Edgar Dale cone of experience, which was revived in 1960s? There, you must have heard Edgar Dale. There is a learning pyramid as well. So, Simu, tell about that Edgar Dale's cone of experience.
Yes, I do remember. It is also known as learning pyramid. It tells us that mental activity is stimulated through the 5 senses. The more senses that are engaged during learning, the more we absorb. That is 10% of what we read, 20% of what we hear, 30% of what we see, 50% of what we see and hear, 70% of what we say, and 90% of what we say or do.
Very nice, Simu. So, you saw that what we see and what you do, that shifted to our long-term memory for 90%. तो आप लोग को जब भी स्किल लैब कराई जाती है, जो आपने देखा और आपने किया वो आपके लॉन्ग टर्म मेमोरी में शिफ्ट हो जाता है. ये आज कहीं 1960s में ही एडगर डेल ने ये बात कही थी. और नाउ वी आर कमिंग टू द टेक्नोलॉजीज. Okay, Simu, at the World Changing Idea Summit in New York in October 2014, what was the Google Vice President of Research, Alfred Spector, say about the simulation in teaching and training?
He highlighted research showing that even average students can reach the top 2% of a class with a personal tutor. If technology were employed as a customizable tutor, it could lead to significant improvements in educational attainment.
So you saw even the backbenchers can be among the top 2% if they go with the technology. So next, according to National Education Policy 2020, under the topic technology and integration, it highlights the use of technology such as simulation, learning games, augmented reality and virtual reality in teaching and training. And if you go to our National Medical Commission or in Indian Nursing Council, they are also emphasizing on skill-based education. So our competency CBME, competency-based education system. So we have to go with the technology now. So Simu, let's now proceed with our presentation and introduce audience what is simulation and what is the purpose of the simulation.
Sure, Hari. Simulation is a technique that enables adult learners to acquire skills, competencies, knowledge, or behavior by engaging in situations similar to real-life scenarios. This method of teaching aims to address real-life problems and allows for a thorough discussion after the presentation is over. Nurse educators strive to replicate reality in their practice laboratories, but they find that nursing students often struggle to make the imaginative leap required to visualize a mannequin as a real-life patient.
So simulation technology in nursing education helps nurses practice and develop clinical skills, decision making, critical thinking, and in a safe and controlled environment. When you go to your skill lab, you have no threat of a patient is dying or not. You are having your mannequins and you can learn on that mannequins. So Simu, tell us what is the purpose of this simulation in nursing teaching and training?
Okay, Hari. Let me tell you what is the purpose of simulation. Purpose of simulation is to help students practice decision-making and problem-solving skills and to develop human interaction abilities in a controlled and safe setting. By means of active involvement in a simulation exercise, a game, or a role-playing situation, the student achieves cognitive, affective, and psychomotor outcomes. Students have a chance to apply principles and theories they have learned and to see how and when these principles work.
Okay, next is the types of simulation. I have given 3 types of simulation. One is our mannequin-based simulation. Second is our learn while playing a game, medical video game. And third one is our augmented reality and virtual reality. So,
Yeah, sure. I will now explain you about the different types of simulation. Nursing simulations are an important tool in nursing education, allowing students to practice skills, decision-making, and critical thinking in a safe, controlled environment. Here are some common types of nursing simulations. Mannequin-based simulation. Low-fidelity mannequins. Basic models used for practicing basic skills like CPR, taking vitals, or administering injections.
So, in mannequin simulation, there are two types. One is low fidelity mannequins and one is the high fidelity mannequins. Let's watch a video of low fidelity mannequins. Simu, can you show how the smart simulation mannequin work?
Let's see a demo of our mannequin simulator. Sign in. Choose the procedure from the options. For example,
This is
CPR.
totally app based. You have to log in the app. You connect with, like if it is
Connect
CPR, you
device
connected
to
with
the
that
mannequin.
Bluetooth.
A questionnaire will appear with 3 options. Select
Questionnaire
the
related to
appropriate
that particular
option from the
mannequin.
list and finish the questionnaire. Perform the CPR procedure on the mannequin. The pressure indicator and the timer are displayed on your device.
How much pressure you are putting, it is displaying on your app. Whether you are doing right or wrong, it will be displayed on your app.
The application will display the result and save this information to your profile.
And its result is auto calculated. There is no need of the faculties sitting there and taking the marks. It will be automatically calculated and it will go to the student's profile. Next, high fidelity mannequin. It's a multiple scenario based mannequins. So we have displayed in our stall also. So Simu, please tell us about the high fidelity mannequins equipped with multiple hospital procedure enhancing. Also describe how they provide unbiased results.
High fidelity mannequins. Advanced lifelike models that simulate real patient conditions, including heartbeats, breathing, and responsiveness. These can be used to mimic a variety of clinical scenarios such as cardiac arrest or respiratory distress. A real-time unbiased evaluation is given at the end so that the player can track his/her progress.
So if you are having a batch of 100 students in GNM or BSc nursing, marking each student is take a time. It is easier to a faculty if we go with this app or auto evaluation mannequin. So let us, Simu, please show the short video of multiple scenario based mannequin, high fidelity mannequin, please.
In high-fidelity mannequins, we provide different scenarios to the mannequin where the same mannequin can be a 25-year-old male patient or a 60-year-old female patient. The scenarios given to the mannequins are provided by medical professionals as well as live patient data from the ICU in which the nurses can perform ACLS and BLS skills. The scenarios consist of different questionnaires to test the player's skills, and they need the player to perform different procedures on the mannequin. Nurses can perform skills like checking the blood pressure, giving medicines, performing IV along with many more on the mannequin. The mannequin also gives feedback of showing pain or wrong input by tears. The application gives a report of the scenario to the player as well as to the organization so that the progress can be tracked over time.
So you saw in a high fidelity mannequin, you can feel the tear of the pain also, or you can make a multiple scenarios also. What in ERA, what we have done, since in ERA, every patient is digitalized, our HIS, EHR and EMR are digitalized, so data comes directly from dashboard to this game. If you want to make any scenario, you make that scenario and you can directly connect with the original medication with what we have decided. So then another type I told you, that is nursing simulation game. That is our 3D medical game. We consider the medical education or the nursing education is one of the toughest education because we are directly dealing with the patients. So to ease this, learn while playing. So let's, Simu, please brief us about another type of simulation that is that we use in ERA, so 3D simulation games.
Another type of simulation is nursing simulation games. These games simulate real-world nursing tasks, where players take on the role of a nurse in various healthcare settings. They can learn how to manage patient care, like taking blood pressure, pulse, etc., administer medications, and respond to emergencies. These simulation games help nursing students practice clinical skills, improve decision-making, and refine techniques in a safe, controlled environment. They allow students to learn from mistakes without endangering patients, boosting their confidence and competence through repeated practice and feedback.
So in these simulation games, we have a virtual world in which virtual patient is there, and if a nurse nurse will act as a player in that game, she will go there and she can take, like, I'll show you one example of blood pressure. There will be a tutorial is there, then MCQ will be there, and then you can do that simulation. Let's see the example of this simulation game.
The game is divided into 3 parts: notes, quiz, and procedure. Players have to study the notes to unlock quiz and complete the quiz to unlock the procedure. First, you need to put the BP cuff 2.4 centimeters above the cuboidal fossa on the patient. Use a sphygmomanometer and pump the inflation till it reaches to the 200 mark on the meter. Now release the pressure and listen to the sound.
So in this way, we can take a BP. Like in our stall, our people are there. You can go and see how to take that BP or how to play these type of game. I show you once. There are around 100 simulation games are there, so we can see there. So here also scoring is done automatically. Simu, tell about their scoring, how it is done.
Yes, it is calculated automatically. Auto evaluation is done of all the games played, and a real-time digital test report is generated at the end of the session containing all the previous and current score of the player, hence making the invigilation easier and unbiased, as it is very tough to evaluate each and everything manually to 100% accuracy.
Okay, thank you, Simu. So you saw while playing this, at least it will go to our long-term memory. In my first slide, I told you 90% is retention when we see and what we do. So in simulation game, what we are playing it as a player, so as a student, so it will go to our long-term memory. Now, the next part of our simulation, Simu, let's talk about augmented reality and virtual reality. What is augmented reality? Simu, please.
Augmented reality, AR, is a technology that overlays digital content such as images, sounds, and information onto the real world in real time. In medical and nursing education, AR enables interactive learning by allowing students to visualize anatomy, practice procedures, and simulate real-life scenarios without direct patient involvement.
So in augmented reality, what anything we take like we can take a book and buy our AR headset or our lenses, or even with the mobile, we can augment that. I'll show you one of the videos. Simu, can you show me a small video of AR? This is an anatomy book. With the help of lens, it comes into the 3D. lens will target the eye and it gives the 3D of this. Okay, thank you, Simu. Let's proceed to our virtual reality. Shabi, I request Dr. Deepti, just wear this VR set. आप इसको नहीं, आप एक्सपीरियंस करिए कि पल्स कैसे लेते हैं, आप पढ़ाते हैं, अब आप एक्सपीरियंस करिए वाइल VR. ये सेट कर देगा लड़का, बहुत स्मार्ट है.
Virtual reality, VR, is an immersive technology that creates a simulated environment, allowing users to interact with it through specialized hardware like headsets and controllers. It provides a sense of presence and realism by engaging multiple senses, primarily sight and sound.
So, ma'am has wear that VR headset. Now, I'll show how that game is looking into this VR set that will be displayed in our video.
Yes, why not? I will show you how can we calculate pulse rate in VR.
Hi, a 27-year-old female patient is here. Could you please evaluate her pulse rate?
Good morning, Miss Neeti. How are you feeling today?
Morning, doctor. I'm feeling fine, thanks.
That's good to hear. I see from your chart that we're focusing on checking your pulse rate today. Have you noticed anything unusual with your heartbeat recently?
Not really, but I've been curious about it. Sometimes it feels like it's racing a bit, especially after I exercise.
I see. It's normal for your heart rate to increase during exercise as your body requires more oxygen. Do you recall how fast it gets?
Not exactly, but I can feel it pounding sometimes.
Alright, let's check your pulse rate today to get a better idea. Do you mind if I take your pulse?
Go ahead, doctor.
Well, let's begin with finding the artery.
Sure.
Now carefully count the pulse
Okay.
and raise your left hand wrist to see the clock.
Okay.
Great job at counting the pulse.
Okay.
Well done.
Thanks.
There is a difference between seeing and doing this. So, madam must be experiencing how taking pulse. So, thank you. So, you saw how we can take pulse by the VR headset. Now we have covered the area of simulation using in teaching and training. Now for the clinical, for the treatment. There madam also in the first lecture madam told about real-time remote monitoring dashboard. So we'll show, we have also made a real-time remote monitoring dashboard in which every equipment what we name in ICU, it is integrated with our software. Even your DVT pump, positioning of the patient, that we have used the machine learning into this. So Simu, tell a small, let's play a small video of real-time remote monitoring dashboard If I'll get time, I'll show you live also that real-time remote monitoring dashboard.
Yes, sure. Real-time remote monitoring dashboard and EMR. High-quality treatment. EHR and EMR plays a vital role in modern healthcare, improving efficiency, patient care, data security, and decision-making while reducing costs and errors. Its adoption is essential for hospitals, clinics, and public health institutions to provide better, faster, and more accurate healthcare services.
Real-time remote patient monitoring. The dashboard lists patients along with their live vitals, namely blood pressure, oxygen saturation, respiratory rate, heart rate, pulse rate, and temperature, and the latest investigative parameters. All these values are color-coded to visually differentiate abnormal parameters. The live patient data is continuously analyzed by the dashboard to sort the most critical patients to the top of the list. AI-powered dashboard. Smart alerts on the dashboard are backed by AI and enabled for drug interactions. Drug interaction can be enabled in the dashboard to notify in case of any interactions between a set of prescribed medicines. Based on the severity of these interactions, they are categorized into mild, moderate, severe, and fatal. Drug contraindications. Drug contraindication can be enabled in the dashboard to notify in case of any interactions between a set of prescribed medicines and disease. Based on the severity of these interactions, they are categorized into mild, moderate, severe, and fatal. Dialysis catheter. This will appear if catheter assigned. Extubate. This icon will appear. The patient is being extubate. Cannula 18G color green. Cannula 18G color green assigned by nurse and technician. Patient volume assessment. This icon will appear patient volume assessment taken by nurse. Volume assessed at date time, volume status, duration, volume balance, volume intake in last 24 hour, volume output in last 24 hour. Central venous pressure, CVP. This icon will appear, central venous pressure, CVP, assigned by doctor and technician. Blockage fluid. This icon will appear, blockage fluid. Patient supportive. This icon show how much the patient supports the nurse and doctor, like food, med sign, supplement. DVT pump, DVT pump. In this, if the DVT pump is provided to the patient between 0 to 4 hours, the DVT pump icon is shown in the green color. But if the time of DVT pump exceed from 4 hours, the icon is shown in the red color. Patient position. Patient position. In the life support and diagnosis column, an icon of patient position is added which indicates the position of the patient. If the patient is in the same position for 0 to 2 hours, the icon is shown in green color, but if the patient is in same position for more than 2 hours, the icon is shown in red color. Blood transfusion. Blood transfusion. It shows the date and time of the blood transfusion. Real-time alert and notification. This shows the notification on behalf of the vitals of the patient, which supplement, medication, nutrient, advice given to the patient. If the oxygen saturation is lower than the desired oxygen level set by the doctor, then the software sends an alert to increase the oxygen support. Similarly, if the oxygen saturation is higher than the target, the dashboard gives a notification.
So you saw that everything is automated here. Nothing you have to enter. आप डेटा देख के सोच रहे होंगे कि बहुत ज़्यादा एंट्री करनी है. Most of things are automated. Like we have used the machine learning. We have put camera onto this, so it is taking that you have put the protocol that within 4 hours you have to position that patient. अगर 4 घंटे में नहीं किया आपने position, तो it will give us that alert that you have to position that patient. Even if you haven't used the DVT pump, if patient is in a ICU, so these will give you a smart alert. Since his BP is getting to normal, so you have to taper that no rate. So everything is automated. Even the patient is at 10th position, he became sick. he will come to first, second and third. So in a minimum manpower, you can manage maximum patient. So let's talk about the era how we are using a single portal for the simulation. So Simu, tell about what is the single portal we are using in ERA for different simulations.
Yes, Hari. ERA has its own website named DigiNurse that contains all the simulations used by various departments, namely Digi Simulations is our 2D game platform where the players study notes, answer quizzes, and then practice on a virtual patient. There are several scenarios ranging from applying injections to first aid protocols. Mannequin Simulator. Mannequin Simulator is an application in which our mannequins connect and they give feedback to the application if the user is performing the skills correctly or not. First, the user has to answer the quiz and then perform on the mannequin, which is then automatically graded. Medical VR game. Our games are available on the VR platform to provide an authentic and immersive learning experience for our students. The game has several scenarios like pulse evaluation, CPR, and many more to provide the students accurate and immersive learning. MedLab. MedLab is a web-based software that provides students access to all the lectures in their curriculum. Students can access integrated lectures, 3D animations, and recorded lectures. CARE or Computer-Aided Revision and Evaluation is an app-based revision tool that facilitates self-learning for students. It offers daily interactive educational exercises based on the topics covered in each day's lecture. MedicoSkills is a web-based clinical skill assessment platform developed for the support of medical and paramedical students. This portal provides multimedia-based questionnaires that follow the OSCE and OSPE teaching and evaluation methodology. Emergency Doctor Simulation. Emergency Doctor Simulation is our 3D game platform where the players study notes, answer quizzes, and then practice on a virtual patient. There are more than 100 medical scenarios present. Designed and developed by Criterion Tech Private Limited. Edumation is an extensively integrated and feature-rich LMS, learning management system, focused on making online education highly functional and hassle-free.
So how you saw that in a single portal we can use the multiple scenarios into this. The multiple games are there, multiple, like after every lecture you can give a questionnaire to students. It's the app-based questionnaires is there. It is not only questionnaires, you can then match the following or labeling. This can be done into this. Then Simu, tell about the benefit of this latest technology, benefit of simulation.
Yes, I will now explain some of the benefits of simulation. Hands-on learning. Provides practical experience in a controlled environment. Skill enhancement. Improves technical skills and soft skills such as communication and teamwork. Bridging theory and practice. Offers a bridge from classroom learning to real-world application. Mistake-friendly. Learners can make mistakes without risking patient harm. Practice rare procedures. Even experienced clinicians can benefit from simulation when practicing rare procedures. Improve patient care. Improves technical skills and soft skills such as communication and teamwork. Unbiased result. Automatic scoring results in quick analysis of users' performance, hence leading to lower interference of faculty, giving an unbiased result. Real-time feedback. Allows students to learn from mistakes and improve their skills. Improved retention of information. Combination of visual, auditory, and sometimes even interactive elements increases engagement and helps with retention. Develop fine motor skills. Allows the user to engage their entire body in the simulation, which is especially important for practicing physical tasks like surgery or physical therapy.
So you saw what are the benefits of simulation. I will not repeat it again since it's going long. So
now, Hari, since it has been a long presentation, let us conclude it.
So let's conclude this session. You saw by utilizing nursing simulation, mannequin interactive simulation games, 3D animation based teaching, self-evaluation apps like CARE, medical skill, etc. program, we deliver top tier training that ensures long-term knowledge retention. Combined with AI and machine learning, enable real-time remote monitoring dashboard, EHR and EMI, electronic health record and electronic medical record systems, we achieve error-free medical care, ultimately enhancing patient safety and ensuring the high-quality treatment. So thank you very much. Thank you, Simu.
Always with you, Hari. Dear all, AI, artificial intelligence, and technology will always enhance everyone's skills.
So technology or artificial intelligence or whatever we call this chat GPT, everything will enhance our language. It is not that it is downgrading us. So thank you very much.
Thank you, everyone.
So this is my QR code. If you have any questions, you can drop into this also and you can ask me also. You can take the photograph of this. Thank you.
A truly thought-provoking session. Thank you, Mr. Dr. Hari Shankar sir, for such an informative session. Now I invite Dr. Dinesh sir to share his observation and takeaways from the discussion.
So we understood that technology is here to stay. So me saying AI is going to be here. So are our rights, client rights. So let us see how can we blend the two. And in fact, one is addressing the other's problem, because now going into the future, patients won't let you touch. Let's accept the fact. Patients are very knowledgeable, they know their rights. हमको छूने भी नहीं देंगे, practice तो छोड़ दो. So we do not have choices. Thank God we have people like Hari and I think Dr. Zoe has a bigger role here, and supported by Dr. Abbas and everyone. So way back 2021 or 22, when we first interacted, actually in Johns Hopkins, we do have a very bright minds in our innovations lab. And we have done a lot of innovations. In fact, ma'am, like you mentioned, laparoscopes, we were the ones who introduced laparoscopes. So we come from that legacy. And when I heard about it, when I met Dr. Zoe and all, I said, we have something in common. Let's collaborate. And thank God, over 4 years now, just two months back or 1 month back, we have had a MOU with ERA to take technology forward. And the whole idea is, it should not remain in big institutes. My last person, you are all privileged to be part of a bigger institute, where you have all these facilities. So our concern, and Vice Chancellor Abbas sir and every one of us were and are working towards that. I mean, we are concerned about the fact that technology should reach the last person. That is what the real use of technology is. And thank you, Hari. He is working in that direction. We have been working. I still would say, Hari, your mannequins are not like the soft touch. They've become softer. I saw them. They've become softer, but still long way to go. We will together work towards that. And this is wonderful. Right from the classroom teaching to the skills lab teaching to simulation, because now we won't get patients to practice. So all this thing is clubbed in one this thing platform, LMS is there, everything is there for us to use, but we should make it possible. You should also be open and and we will also see how best we can collaborate. Thank you so much. Thank you so much.
Thank you so much, sir, for your valuable feedback. Now I invite Dr. Deepti Shukla ma'am to present a token of appreciation and gratitude to our esteemed speaker.